This video is designed to introduce hyperbaric oxygen therapy, also known as HBOT. It's a general introduction to the entire process of arriving at the clinic for the first time, introduction, interview, and administration of tests that you may be asked to take, the HBOT dive protocol, startup of follow-up treatments, and final thoughts. Much more thorough information is available at www.treatnow.org. Hyperbaric oxygen therapy has a long history, going back centuries. Starting with the bends or decompression sickness, doctors began to hear from hard hat and scuba divers that they were seeing better, sleeping better, clearing their brain fog, and getting general relief from pain after these treatments. We can help match you with a clinic that suits everyone's needs. It is up to you to contact the clinic, make arrangements, schedule your first appointment, and, importantly, make a promise to yourself that you're going to complete the treatment. Your life and the lives of those close to you will get better. In the same way that no two brain wounds are the same, no two doctors or clinics are the same. The good news is that the HBOT protocol can be tailored to your particular circumstances. A whole set of factors determine your course of treatment. Your past history, your current symptoms, diagnosed conditions, years since your injury all figure into the course of treatment. The doctor will also ask you questions about facts that could prevent you from going into the chamber. Even though HBOT is one of the safest devices the FDA has ever approved, some conditions are too risky. Certain conditions could cause problems. Once the doctor finishes his interview with you, he will hand you over to another medical professional, typically a nurse or a psychologist, for a different set of questions. One fairly common test is brain mapping. Using a sort of swimming cap embedded with receptors, doctors can then map your brain waves and get a picture of how your brain reacts to stimuli. The brain map uses age, gender, and handedness as controls and produces colored maps which give a picture of the areas of the brain that are normal and over or underperforming. From those maps, done often with quantitative electroencephalopathy, the data collected then charts the strengths and weaknesses in your brain patterns. This test is normally done at the beginning of treatment, midway, and at the end of the treatment. Improvements in brain performance can be expected as the brain wound heals. Other tests that might be given before the first dive might include the Automated Neurological Assessment Metric, or ANAM, developed by the Army, the CNSVS, the Central Nervous System Vital Signs, a Suicidal Ideation Screening and Questionnaire, the PCL-M, a PTSD screening for the military. These tests are confidential and subject to all confidentiality and privacy agreements according to the HIPAA regulations. You and the medical staff will see the results and, with your permission, can be used without identifying you for aggregation, scientific analysis, and research reporting and publication. Once testing is completed, you are taken to a changing room. Cotton scrubs are the normal dress for the chamber. Patients are encouraged to wear no makeup, jewelry, or metal. Depending on the type of chamber being used, you will be instructed about the protocol for electronics.